evening, and thank you for tuning in to the Cook County Bar Association's Live on CAN TV. I am your host, Mika Thompson, and today we have a guest, Arthur Mingo, and he will be discussing the topic of the affordable AHCA, right?
Right.
Affordable Health Care.
It's the American Health Care Act.
American Health Care Act. Thank you. Okay, and so if you have any questions regarding this topic, please call the number that appears at the bottom of your screen. That's 312-738-1060. Okay, please know you can also view this show on www.cantv.org/live. As you may or may not know, the Cook County Bar Association is the oldest association of African American lawyers and judges in the United States. And we take this time every Tuesday at 6 p.m. to discuss legal topics and provide you with helpful information. Okay, so the first thing I'd like to do is to allow our guest to introduce himself.
Hi, my name is Arthur Mingo. I am an attorney here in Cook County. A little bit about my background. I have a bachelor's and a master's in political science. My master's focused on Congress as an institution with a particular focus on campaign finance, reform and regulations, McCain-Feingold. I graduated from Southern Illinois University School of Law in 2014. I have worked on various campaigns throughout the state of Illinois, including Dick Durbin, Barack Obama, Pat Quinn, all the way down to local elections like Michelle Musman, who was a state House member. So I'm pretty well versed in politics and policy.
Great. And then a little bit about the Cook County Bar Association. Now, the Cook County Bar Association is an association of attorneys that handle a variety of areas of law. So if you need an attorney and you need an attorney to address an issue that is not being discussed on this show today, please contact the Cook County Bar Association Lawyers Referral Service. It's at 312-630-1157, extension 21. You can also find a lawyer on the website, and that's www.cookcountybarassociation.org. Before we begin our discussion, I'd like to remind the audience that the attorneys that you see today, myself and Attorney Mingo, do not represent your interests. We're here specifically to discuss one area of law, and that is the American Health Care Act, right?
Yes.
Okay, American Health Care Act. So, like I said, this show does not necessarily reflect the views of the Cook County Bar Association, the opinions of the sponsors of the Cook County Bar Association, its board members, its officers, or members. We are grateful to have this opportunity to have Arthur Mingo here to give us some information with regards to this particular area of law, this act, because it's still a relevant issue with our Congress, and there's a great possibility that health care reform another act will be presented before Congress. So we want to be clear about what the act, the Health Care Reform Act, that was considered, and we'll do another show to give you some information as to where we go now that this particular act did not pass Congress. So with that, we're going to start.
All right.
Okay, so my first question to you is, give the audience just a basic understanding. What was the American Health Care Act? What was that?
All right. The American Health Care Act is the Republican response to the ACA. It's also sometimes known derisively as Obamacare. In 2008, President Barack Obama made a point of saying that he was going to pass health care reform. The health care reform that we end up receiving full name is the Patient Protection and Affordable Care Act, the ACA. It did not receive a single Republican vote during its time in Congress before it was signed by the president. Since then, Republicans have derided the ACA because they don't like it. They don't like the way it works. When President Trump was elected, he said one of the first things that he was going to do was reform healthcare because, in his opinion, the ACA was in a death spiral. What happened afterwards was you had Congress work diligently for about 40 days, and then they came out with the American Health Care Act. The American Health Care Act is one of three, as Sean Spicer, the press secretary, would say, buckets to repealing the Obamacare Act. Fundamentally, Republicans generally don't like the Affordable Care Act. They don't like how it works, what it does, and they much prefer their system, which is the American Health Care Act, and that's what AHCA stands for. It is a tongue twister.
It is. Thank you for saying that. Okay. So what aspects, and we're going to kind of break it down because the AHCA, the Republican version of healthcare, tried to do a lot of different things. So the first thing we're going to look at is the repeal aspect of it. And I mean, to the extent that this blends into other provisions,
right,
that's fine. But for the audience, we're trying to break it down piece by piece. So what aspects of the Obamacare would the AHCA actually have repealed?
All right. I think the best way to answer that question is actually not to talk about what repealed. Is to talk about what it did not repeal. So
Okay.
one of the things that people like about the ACA, the American Affordable Care Act, people like the fact that children can stay on their parents' plans till they're 26, that there is no bar for a pre-existing condition, that women and men pay the same for their health insurance, that the elderly, which is something that is not as well known, but before the Affordable Care Act, health insurance companies would charge sometimes 10 times for a health insurance policy that would be exactly the same for someone that was maybe 40 years younger. So if you were in your 30s, what you would pay in your 30s would sometimes be multiplied by 10 if you were in your 60s and you just asked for it right off the bat. The American Health Care Act touches none of those things. What it does touch are the things that make all those goodies possible. So the American Health Care Act removes a lot of taxes. There were what people commonly call them as Cadillac taxes.
Okay, so when you say that it touched on the things that made it possible, you're talking about the money, the funding.
Right, the funding.
The money that would make it feasible, that finance the ban on,
Yes.
the program.
Yes,
Okay.
because at the core of what the Affordable Care Act is doing, the Affordable Care Act is pushing people who do not have health insurance into the private market. When people think of these exchanges, all the exchanges are just simply stores, and insurance companies put their wares forward, and then people buy it. Well, if you're going to tell insurance companies, you have to take everyone. You have to take them regardless if they're sick. Mm-hmm. They can stay on the parents' plan until they're 26. If you're going to say we're going to have all these things that you now have to do, you have to have what they call the essential health benefits. There are 10 things that pretty much every health insurance plan must cover.
So it's pay for. When you say what they have to do, this is what the insurance company
is going to have to pay out.
Pay out.
It's going to have to pay out. So insurance companies said, okay, we will take these new customers because at the end of the day, they're like customers.
Right.
But we're going to be getting a lot of sick people.
Okay.
So we have to find a way to offset it.
And when you say the sick people, that means there's sicknesses, treatments, services that the insurance company would now have to pay that they wouldn't have to pay had these provisions not been in. They were not mandated.
Right.
Okay.
So before the ACA came around, if you had, let's say, fallen down the stairs at your home when you were 25,
okay,
and then when you turned 40, you said, I want to get health insurance. It's time for me to have health insurance. That could be considered a bar for health insurance because that's a pre-existing condition. Because the insurance company might say, well, now we have to start, we're going to start paying for treatments because when you fell down the stairs when you were 19, you had a metal rod put in your hip, and now that rod is corroding, and so now we have to spend a lot of money to fix that. We don't want that.
And for the audience to understand, had that person signed into the health insurance, they would have been putting 25 years of payments.
Right.
Or 20 years.
20 years of
payments into it, and now that they're 45 or in their 40s, they had some money. The insurance company would now have money to support these now treatments, but this person did not do that. So now they're looking for coverage, without having contributed to that insurance system.
Right, because that's how insurance works. I mean, at the end of the day, insurance works by, we put everyone in, everyone pays a little bit every month, and then when one person is sick, we use all that money that we've stored up to pay for the sick person. Well, insurance companies said when the ACA was being drafted, we don't like the idea of, well, the health people we're not really concerned about, but there is a large population of people who are sick, who that we have said we will not insure them because of pre-existing conditions. Well, if we bring them in, they're going to be too expensive to handle. So the ACA, to combat this, has a lot of subsidies to help pay for those people. For people who are poor and who never could afford health insurance, the ACA has subsidies to help with those people as well. So when the Affordable Care Act, the American Health Care Act came around.
And let's just make it simple. The Republican version versus
the Democrat version.
There you
Okay.
go.
Well, the Republican version said, well, we're gonna make some changes.
Okay.
Right now there's a mandate. So remember how I told you insurance works by you have everyone in, and that way if someone gets sick, we use all the money that we've saved up to pay for that sick person.
Right.
Well,
and it assumes that everybody that's in is not going to get sick at the same time.
At the same time, just like car insurance.
Right.
So the Democratic plan said, well, you know what? There's a problem called the free rider problem. Before the Affordable Care Act, I'm not going to buy health insurance until I'm sick. Well, the Democratic plan takes care of that by having a penalty. If you don't join, you have to pay money. That money goes to maintain the system. The Republican plan does not get rid of that penalty. The IRS just will no longer enforce it.
Wow. Okay.
So it will still be there. So you are technically still in violation of federal law, but by not having health insurance. It's just that no one will come after you.
Oh, okay.
So that's gone. When you think about how does the federal government pay for people who need subsidies, whether they be poor or very sick, the Democratic plan said, well, we're going to have a whole levy of taxes on different things. We're going to have taxes on sunbeds. We're going to have taxes on medical device makers. We're going to have general revenue. We're going to have all of these different taxes that we're going to use to pay for these subsidies. Well, the Republican plan, the AHCA, gets rid of those taxes. The idea being, no, we're not going to pay for that. We're not going to pay for those subsidies. What the Republican, I have to remember to keep saying Republican, what the Republican and also the AHCA also does, the Democratic plan, the subsidies that you received were based basically on really three things: your age, where you were, two things: your age and where you were. Your age, where you were, and your income. I forgot. There were three things. So the amount you received could fluctuate. If you made more this year and you still qualify for subsidies, you're going to receive a little bit less. If you had a change in circumstances where you lost a lot of your revenue, where before you were making really good money and now you're not making a lot of money at all, you would start to receive subsidies, and those subsidies could be very, very high. Because the idea is that you're expensive to insure. Those insurance companies saying, remember, this person's expensive. So then the Democratic plan, the ACA, had subsidies that sort of met your need. That is not the case under the Republican plan. It's a flat rate.
Okay.
So under the Republican plan, or the AHCA, the minimum that any person would receive would be $2,000. You're not going to receive any less than $2,000 if you qualify. The maximum you receive is $5,000. That is it.
Regardless of whether you
need more or less.
Need more or less. Okay.
You just receive that amount. The way it scales, it's all based on age. So if you are under 30, you receive $2,000. 31 to 40, $2,500, so on and so on. So it scales up. So once you hit about 60, you max out on how much the Republican plan or the AHCA will give you for subsidies. There is nothing in the law that scales up on a year-to-year basis the overall amount of monies that is received. So if the AHCA or the Republican plan were signed into law, if today $2,000 met your health care needs, and 3 years from now you're 34. If you're 30, if you're 30 and 3 years from now, you'll be 33 years old. If you're 33 years old and all of a sudden your health insurance needs are more than $2,000, the AHCA or the Republican plan does not scale up.
Gotcha.
All you receive is $2,000 until you turn 41,
and then
you receive $2,500.
Gotcha.
That's how it scales up.
And the older you get, you do tend to have more health care issues. And
Right.
and with inflation, that's also going to increase your
Right.
need for
Because-
the subsidy. And that's just to cover the premium. We
Right.
haven't talked about the co-pays and the deductibles and the
Yes.
medications.
No, we haven't.
Okay.
And inflation makes every dollar worth a little bit less. And in a 10-year period of time, that $2,000 that you're receiving from when you were 30 and now you're 39 is not effectively $2,000 anymore. You're closer to it being around $1,300. So yes, you're still receiving the same, $2,000, but its buying power has substantially decreased. The other way that the Democratic plan or the ACA dealt with people who need insurance was through Medicaid.
Okay.
Medicaid. Yes, Medicaid. Medicaid and Medicare have very similar names. They always trip me up. Essentially, Medicaid is for people who are poor. Medicare is for people who are over 65. States opt in to want to expand Medicaid. The original plan was that you are a state. If you do not expand your Medicaid, then at that point in time, you lose all Medicaid funding. States,
Now, wait a minute. Explain to the audience what that means by expansion, because there was a lot of discussion on Congress and in those listening
tours. Yes.
that the president had regarding that, and I don't think that it was completely explained. What is this Medicaid expansion, and how is that different from just the average Medicaid program that people get?
And I want to correct myself. I think it's Medicare.
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 Okay.
It's my fault because
Right.
the names are so very similar.
Right.
So Medicare is insurance for people who are very poor.
Okay.
The idea is that we want to sort of catch people who are at the bottom of the ladder and make sure that they have health insurance. The Medicare expansion. So Medicare is based on a whole formula, but essentially states can sort of mess with the numbers a little bit to determine who will and will not be covered.
Okay.
What the ACA did was the ACA, or the Democratic plan, said we're gonna insure more of the bottom,
Okay.
more of the bottom people. So if this table is a floor, and here are people who are completely insured, the Medicare was right here at the bottom for some states.
Okay.
And so what the Democratic plan or the ACA did is that we're gonna raise that up a little bit. We're gonna cover more people in Medicare.
Okay.
So here are people who are normally covered, and here is the expansion. So this little bit of people are people who now qualify for Medicare because it's been expanded to those populations.
And usually, is that group that you're talking about that would be covered under the Medicaid care expansion? Isn't that your more lower income?
Yes.
Yes. In that middle income group, that lower middle income
Yes,
people.
it's people who are people who are low income, or people who, if they only made like $500 less, they would qualify.
They
for Medicare.
would have qualified.
They would qualify for Medicare.
And that's families also.
Yes,
Too.
that's families. And so the ACA said we will force states to do this. If you choose not to, you lose all of your Medicare funding. The Supreme Court said you can't do that. You can't force a state to make that choice. States have to elect to expand Medicare. Well, states have started to do that. Illinois has expanded its Medicare, as have a lot of states. What the Republican plan, or the AHCA, does is it closes that window. If you have not already expanded your Medicare, you will no longer be able to expand Medicare if it were signed into place. Additionally, for those that have already expanded, people who have health care through Medicare expansion are grandfathered in. The minute they are no longer Medicare expansion eligible, they can no longer go back to Medicare expansion.
Okay.
So if you are in Medicare expansion and you got a really nice job, you make a little bit of money where you're outside the bubble of Medicare, let's say the economy takes a downturn, you lose your job. And you say, well, I had Medicare before, I should get it again. No. That Medicare expansion is a one-way door. Once you leave, you cannot come back.
And that's under the Republican plan.
That's under the Republican plan, yes.
Okay, and another thing that we also want to clarify is that there was a lot of conversation in a number of states. Their citizens were upset with the Democratic plan for health care because they're saying they did not have doctors as a consequence of it, and they did not have the option. They weren't eligible for the services,
Subsidies.
the subsidies. That is the issue. In some of the states, they had not elected to do the Medicaid expansion. So some of those that were upset with Obamacare is due to the fact that they did not get the full benefit of Obamacare because their state refused to do the expansion.
Correct.
So the conversation and the discussion with regards to some people that objected to the cost is due to the fact that their state really did not allow their citizens the opportunity to get the benefits, to get the full benefit that they may have been eligible for
Right.
with the Obamacare. And they still have the option, and these states still will not elect to provide that option to those citizens.
Well, the thing that's interesting about the Medicare expansion is the way the federal government, the bargain that the federal government makes with states. The bargain is in the first 10 years, the federal government will pick up 100% of the cost of adding these new people on. After 10 years, it drops down, depending on your state, anywhere from as low as 85%, as high as 99%. So for a lot of states, this isn't really a fiscal issue. It's a philosophical issue. It's a question of, whenever I talk to people about the Affordable Care Act and the American Health Care Law Act, the question always comes down, which do you care more about? Do you care about the philosophy, or do you care about the numbers and the dollars? For a lot of Republicans, for them, this is a philosophical conversation. For them, they fundamentally just don't believe in government sort of pushing its hand into private markets. For them, it's, health insurance companies know better than anyone else who should and should not, under their rules, qualify for health insurance. And having the government come in and telling, Aetna, Blue Cross Blue Shield, you must take these people, you must do this and that, for them, they see that as an infringement on free markets. For me, I look at it as simply as the dollars. I look at the money of it. To me, it's cheaper to have the Affordable Care Act than to not have it, because otherwise people will still find ways to get their health care, but they're going to get it in the most expensive way possible, which is they're going to go to emergency rooms.
Right.
My mom was a nurse at University of Chicago Hospital, and I remember many a time me visiting with her, staying with her, and walking around the hospital and seeing people, at 3 o'clock in the morning, right before school started in Chicago, in the emergency room for the immunization shots for their child because they did not have health insurance. But the emergency room is the most expensive way to deliver health insurance, to deliver health services, and because of that, and because of people who, if you're going to the emergency room for immunizations, that means you can't afford to pay. Mm-hmm. And if you can't afford to pay, the hospital is still going to provide that service, but they have to find a way to make up that loss because they can't run negative. And so how do they do it? They do it by jacking up private insurance rates. So private insurance is now having to pay hospitals more because hospitals are trying to find a way to cover their losses from people who came into the emergency room. Well, the insurance company's not going to suffer that loss. So what do? They jack up their rates and they pass on to their customers.
See, that's the part of the conversation that wasn't had, and I'm so glad that you're here to explain that, is that the assumption is that if we avoid Obamacare and if we avoid the Medicare expansion, then somehow those costs are not passed on to you. It is passed on to you. Mm-hmm. If the people, regardless of whether they're on Obamacare or not, are going to get health services, they're going to go through the emergency room, and that cost is passed on to everybody else. Oh, we have a caller. Caller?
Yes, good evening. I just wanted to make a quick comment. I used to work for years for one of the large insurance companies, and I know when I was younger, one of the first things, when you go out looking for your first job, an entry-level job, that's how you get going in life because you realize you want to have some insurance for your children. If you go popping out children and always expect the government to pick up your costs, and I don't care whether it's insurance or housing or food, face it, you're digging a big hole that some people are going to be very comfortable lying in that hole because everything's been done for them. So rather than demonize the Republican plan, I think people should, cross over and put their heads together and put something out there that everybody can live with. Nothing is free. It's a terrible message to send people, particularly when you're young. You don't want to give anybody the idea that children are going to be free, their health care costs are going to be free. I'm not trying to demonize them, but my God, who raised people with that kind of mentality? It's not right for anybody, regardless of their race, creed, or anything. You get out there in life and you try to make an honest life for yourself, and part of that is get that entry level job, something that at least has insurance, so you've got coverage for your kids instead of getting ahead of yourself and having the kids before you got the insurance. And if people did that, you wouldn't have so many people in that dire of need. And I appreciate I know a lot of people out there probably don't understand the difference between Medicaid and Medicare, and so it's good that you explained that. But I just wanted to point that out. Again, I don't think we can demonize people for saying, look, it's about time that people realize that there is a cost to everything, and people have to put their heads together to solve it. Thank you.
Thank you so much, caller, for your comment. We will have to conclude and give you the last statement, and then we'll have to conclude because we're running out of time.
All right. Well, I'll keep this short. To the caller, you're right. Nothing is free. And we have a bit of a terrible situation, but I would say that at least when it comes to dollars and cents, because that's what I tend to care about, the ACA, it bends the cost curve down for people who have private insurance and it makes sure that we have more people insured. I think that you make a valid point. We have to make sure that we contain costs because nothing is free. We all are going to have to pay the bill at some point in time, but at least the ACA, I think, in my opinion, was a step in the right direction.
All right. Thank you, caller. Thank you, Arthur Mingo. And I'd like to thank the CAN TV staff for being our phone tech today. Please tune in next week when we will be talking with our host, Lewis Powell II, on another topic, Lewis Powell III, on another legal topic of import to our viewers. Thank you again for tuning in. You have a good evening.